Hi, my name is Anne-Kathrin Fett. I'm a reader in clinical and biological psychology here at City University. And I'm going to present a review to you which we recently conducted on the question of how interdisciplinary methods can help us to understand the effects of the city on mental health. Many epidemiological studies show that mental health problems accumulate in cities. Now, that's important because already today, about 55% of the world's population do live in cities, and further urbanization is occurring, with predicted 70% by 2050. So does that mean that more and more people will suffer from poor mental health? And if yes, why are cities so unhealthy? So in this talk, I'm going to give you an overview of what we already know from existing research. The most robust evidence for link between urbanicity and mental health probably comes from the psychosis literature. Here I'm showing you results of a meta-analysis of Evangelos Vassos and colleagues at King's College London. So they looked at population-based studies and compared early urban exposure, so below 15 years of age, to living in rural environments, and then investigated how this was associated with the risk for the later incidence of schizophrenia. And you can see here the pooled effect size was 2.38, so living in very urban environments as compared to non-urban environments was associated with a 2.38 times greater risk of having a diagnosis of schizophrenia later on. So this points toward this link between urbanicity and poor mental health. Now what's important is that all of this data came from Northern Europe, from Sweden, Denmark and the Netherlands. More recently, literature emerged that actually shows that this evidence might not be as clear-cut as previously assumed. We've reviewed that in a paper called Psychosis and Urbanicity, so if you're interested, I would like to point you towards this. Now, we found, for example, research by De Filder and colleagues who looked at the psychosis-urbanicity link in 42 low and middle income countries and who didn't find this association between living in more urbanized environments and having a greater risk for psychosis. More recently, also work in Europe suggested something similar. So evidence from the EU GI study, for example, showed the link between living in urban environments and having a higher risk for psychosis in Northern European countries, the UK and the Netherlands, but didn't show this link in Southern European countries, in Italy, France and Spain. So also here it seems that the evidence is not as clear-cut. And then finally, there's also evidence emerging from other fields looking at affective psychosis and depression and anxiety in Ireland, Peru, the US and the UK, where actually living in urban environments is associated with lower incidence of these disorders. Which mechanisms might explain this link between mental health and the city? First of all, living in a city is associated with a risk for poverty, inequality, and a higher risk for life events due to exposure to crime, for example, or accidents. Then there are many epidemiological studies which actually show that low availability of green space is associated with poorer mental health. And there might be different reasons for that. So one factor, for example, that might be important is that green space helps us to reduce stress, that it helps us to reduce taxation on attention, so we might restore our cognitive resources, but it might also be conducive to all kinds of health behaviors, such as moving outside or being social with others. On the flip side, a lack of green space is of course indicating also a possible presence of environmental pollution. And this in its own right can impact on the nervous system, particularly when it's developing, and might have negative effect through these pathways on our mental health. Then we have in cities noise and light pollution, and both have been associated with reduced well-being and, for example, also increased aggression. And of course, light pollution and noise pollution may also impact on our stress levels and sleep, and through these pathways impact mental but also physical health. Then we see that in cities we often have high levels of migration. Being a migrant, being a minority in a city has also been associated with poorer mental health. And last, even though cities are very full of people, research has shown that there's often lower social capital, that people are exposed to many transgressions to personal space, and often people who live in cities complain about higher levels of loneliness. And again, all these factors in their own right may impact on our well-being and mental health. So taken together, these factors impact on our physiology and psychology, and this may explain poorer mental health. Furthermore, this might interact with a genetic risk, so that people who already are at a higher risk for mental health disorder genetically are more vulnerable to these impacts of the city. Lastly, of course, I want to mention that cities can also have positive effects. So, for example, often you might find a higher diversity of different people in cities. People might be more liberal, there's better healthcare, and there are often opportunities for better education. And this might explain also some of the global variations we see. So I now want to come to a number of neuroimaging studies that looked at the link between the brain and urbanicity. And generally, these studies either look at brain function, so they ask people to do a task while they're in the scanner, and then look at whether living in urban versus non-urban environments is associated with differential activations while people are engaged in a particular task. Another type of studies actually looks at whether growing up or living in urban environments is associated with different brain structure. Now, the social stress hypothesis is supported by initial evidence which looked at whether urban upbringing or current city living is associated with a neural stress response in healthy individuals. So they found that current city living under stress was associated with amygdala activity, increased amygdala activity. And the amygdala is an area that's very important in processing of threatening stimuli. Now, this study found also that urban upbringing was associated with more activation in the perigenual anterior cingulate cortex, and that's an area that connects frontal and limbic brain areas, and it has been implicated in emotional processing, contingency learning, and cognitive control. There are also other studies which show that current city living is associated with activation in the amygdala, medial orbital frontal cortex, and the anterior cingulate during reward activation and modulation. So together the results indicate that city living might be associated with a hypersensitivity to social stress, but also differential sensitivity to reward. So it's in line with some of the hypotheses that have been derived by epidemiological studies, saying that urban exposure might lead to a neurosensitization or sensitization of physiological stress systems. There's only one study, or at the time of the review, there was only one study looking at psychosis using a trust game where you have a social interaction between two people. And my colleague Imke Lammers-Jansen has conducted this study. Now, she found actually only that during positive social interactions, the amygdala was activated differently in patients, and that was in the opposite direction compared to the Lederbogen study. So it's a bit of contrasting finding here. Then we have a number of structural neuroimaging studies that actually looked at the association between urban upbringing and brain structure in healthy individuals. And most studies found reduced volume or gray matter thickness in a range of frontal, temporal, and parietal brain areas, as well as some changes in the microstructure of white matter tracts that connect the frontal and posterior brain areas. Although on one study, for example, there was a report of increased grey matter volume in the precuneus, which is a more parietal structure. And that's involved in self-referential processing, memory, and visual spatial processing. Now, there's one study, or a number of studies, which actually looked at the link between brain structure and urbanicity in psychosis, and it has been reported that there was also a link with reduced grey matter, but not with cortical thickness or functional connectivity measures. So overall, these studies imply a link between the city and the brain, which might be due to increased stress sensitivity or altered reward sensitivity, but it's less clear what explains the link between the city exposure and brain structure. Some recent studies have started to investigate the association between urban physical factors and the brain, and I'm going to just give you an overview of a few of those. Kuhn and colleagues, for example, used data on green and blue space from the European Urban Atlas, and they used that in conjunction with structural brain imaging in older adults. So they reported that older adults who lived close to forests had increased amygdala integrity. So remember, that's the area implicated in threat processing. And integrity was based on 3 different neuroimaging sequences of gray and white matter density. The study also investigated with associations with urban green, water and wasteland, and additional regions of interest, the anterior cingulate cortex, dorsolateral prefrontal cortex, for example, for which volume reductions have previously been linked to urban upbringing in particular. However, the study by Kuhn and colleagues did not find any other significant associations, actually suggesting that neuroregenerative effects of nature are specific to this non-urban green space and primarily working on brain regions that are implicated in emotional threat processing rather than those who are more related to, for example, cognitive control. It is, of course, possible that non-urban green space is also a proxy for more personal space. For example, there's less social exposure, or it could be that living close to non-urban green space is also associated with a range of other health behaviors and factors that might explain these associations. There's another study in children which showed that actually lifelong access to residential greenness is positively associated with grey and white matter volume in prefrontal and premotor areas as well as the cerebellum. So maybe effects are different in school-aged children. So this might relate to neuroplasticity or regeneration. Interestingly, the regions that were associated with greenness in children were also positively associated with better cognitive functioning and working memory, and also they were associated with reduced inattentiveness. And that might suggest that impaired structural integrity could underlay some of the cognitive effects of urban environments. Now I'm coming now to some studies that looked actually at the link between air pollution and the brain. So first of all, research from Mexico showed that children who are exposed to very high air pollution had a much higher prevalence of white matter lesions than children who lived in a rural town. And this suggests that there are some neurotoxic effects that might alter the brain structure. However, there's also research by others from smaller cities, came from Barcelona, and this research found that in children between 8 and 12 years, air pollution exposure was mainly associated with reduced functional connectivity in the default mode network rather than brain structure or other indicators of membrane metabolites. So this might point more towards stress-related mechanisms. However, it's of course important to consider that the pollution levels in Barcelona and Mexico might not really be comparable. And there's also some evidence coming from the animal literature showing that pollution is related to neurotoxicity. So, for example, Levesque and colleagues exposed rats to diesel fumes and showed that this actually leads to generalized neuroinflammation in animals. And Fonks and colleague exposed mice for 10 months to ultra fine particles and also found actually that the mice had elevated inflammatory cytokines, reduced dendritic density and branching, as well as some depressive-like symptoms and cognitive problems. So, of course, with the neuroimaging studies, there is the problem that they cannot evidence causality, they are correlational. However, there are also studies which actually have attempted to look at the effects of urban or nature settings and experiments where people are systematically exposed to either specific urban or nature settings or cues in either simulated or real environments. Of course, that's not possible for all urban effects due to ethical reasons. Still, there's a vast literature with convincing evidence that actually shows positive effects of the short-term experience of nature on well-being, cognition, and stress physiology. So, for example, in support of stress reduction, it has been found that viewing photographic images or videos of natural scenes reduces skin conductance, heart rate, and other physiological indicators of stress. And it has also been found that walking through forests and other natural landscapes actually reduces cortisol levels. And some of this evidence has been nicely reviewed by Schuder and colleagues. There are also a number of really interesting studies that send participants on walks, randomized to urban or nature conditions or urban conditions versus staying inside. And a group of researchers here in London at the Institute of Psychiatry, Psychology and Neuroscience, for example, sent their participants on either a local walk on a deprived high street for 10 minutes. In one study also participants had a shopping task while they did that, and the control condition was being inside in a testing room, either watching TV or doing mindfulness exercises. And I found that being on the high street and doing the shopping task actually increased paranoia, anxiety, and negative effect. And this was actually not only found in patients with psychosis, but also in controls. Another study that did something similar was conducted in Newcastle, and they sent students to distribute a survey either in a deprived neighborhood with high crime rates or in an affluent neighborhood with low crime rates. And in line with the previous findings, this study actually also showed that participants reported higher paranoia and decreased trust when they were in the deprived neighborhood. Similar evidence also comes for other disorders such as depression. For example, it has been shown that a 50-minute walk through a natural environment can increase positive effect and can reduce negative effect, anxiety, and rumination. So there's some good evidence demonstrating the benefits of nature experience on well-being. Now, also with these studies, even though they generally show positive effects, there are some limitations, namely often the conditions are not very well matched, for example, when it comes to threat levels, social threat, the beauty of the environment, the noise, the pollution of the environment, and also there are a lot of differences in terms of the duration to exposure to either urban or nature environments. So there's still a lot of open questions around whether these effects are stronger when exposure is longer and how long the effects last. Now, lastly, it's very important to understand that places do not just happen to us, but that how we live them and how we move through them also depends on our individual characteristics and preferences. And there are a number of studies and methods that have tried to unpick this person-place interaction. First of all, there is an ecological momentary assessment method, sometimes also called experience sampling, where individuals have an app on their phone that beeps a number of times per day, and when it beeps, participants complete short questionnaires on their mood states, but also where they are and, for example, who they are with. And these EMA devices can be linked to GPS data and therefore can also be linked to objective place indicators such as, for example, green space, or it's possible to link this with crime data. There has been some research actually using that method to study the link between the environment and well-being. For example, one study from the United States found that adolescents experience reduced stress levels when they're in urban green space further away from home, suggesting that family dynamics might play a role here. And furthermore, there's also research from the UK showing that actually being in nature can increase well-being even for hours afterwards. And due to this nice panel data that EMA yields, it could also be used to investigate, for example, whether engagement with nature is like a means to reduce stress. So if people who are more stressed engage with nature more, this would be indicative of such a mechanism. So it can be used to look at temporal associations. This has not been done, but that's a possibility with this method. Secondly, there are the experience-based approaches. So here, typically, researchers would look at walking interviews, which might be video recorded, and then use sort of elicitation sessions later on. And there has been some exciting work coming from Switzerland by Ola Soderstrom and his group, who did such video recorded go-alongs in individuals with first episode psychosis. And from their study, they found actually that the individuals with psychosis found that the sensory overload and obstacles and the increased social interaction in the city actually increased their stress levels. And they found that the coping strategies that individuals employed involved creating sensory bubbles, for example, using headphones, or really planning their mobility through the space very carefully to reduce urban stress. And then lastly, there are some exciting ways now to also combine these methods with mobile EEG and physiological measures, but this research is pretty much at its beginning, and I think it will take a while until we see sort of more consistent findings in that space. So I'm already far above my allocated time. So in sum, we've come a long way in terms of understanding the link between environments and mental health and well-being. And I think recent developments made it really clear that the picture is far from simple and that we need to do more to understand interactions between different place characteristics and person characteristics, and that we need multiple disciplines and ways of investigation to do that. And here I just wanted to give you a short example of how different factors might interact. So please do take your time to read this and pause the presentation. I also wanted to point you to this paper by Van der Waal and colleagues in Lancet, which actually really nicely explains how different factors associated with the urban environment, social factors and individual factors interact with each other and may exert their effect on different timescales, causing symptoms of poor mental health. So what does this mean for early intervention for mental health problems in a changing world that's more urbanized and that is also facing the threats of climate change? I think the existing evidence makes the case for the need of interdisciplinary work that brings together medical and psychological sciences with sociology, urban planning, architecture, geography, etc., just to name a few. And it's important that academia engages with policymakers and also young people to drive change and to identify actionable targets for policy prevention, intervention, and treatment. There are, of course, several things that can be done to improve places. So, for example, this could include the increase of green space or the improving of quality of green space, safety and walkability in cities, as well as the reduction of pollution. And then secondly, it might involve creating more social areas and initiatives that allow people to connect in cities, to reduce loneliness and social disconnection, to improve mental health. We've recently also done a systematic review of studies that look at the effectiveness and acceptability of place-based interventions that address loneliness and mental health problems, and there were very few that are currently available. Then secondly, of course, it might be around supporting individuals to access their local opportunities when it comes to using green space or opportunities to connect. It might be about helping people to cope with stresses of the urban environment and help them navigate these better. And then lastly, it might also be around changing their perceptions and cognitions of the places they live in. And lastly, I think it's very important to involve young people to make sure that the initiatives are in line with their needs. So thanks for watching. If you would like to read the entire article, it has been published in Psychological Medicine. I would like to acknowledge the entire team who has been involved in conducting this work, and please feel free to email me should you have any questions.